Hello everybody, my name is Liz Darlison. I'm a consultant nurse at the University Hospitals of Leicester and I'm also Head of Services at Mesothelioma UK. So this is another in our series of interviews that we've been doing at Mesothelioma UK, just trying to shine a light on mesothelioma and give our UK mesothelioma community some insight into some of the projects and the work of the charity, and also just to share with you, hot off the press as quick as we can, any new findings, and just to give a little bit of interesting information and hope really through these challenging months that we've had. So we've done a number of interviews, and today's interview is with Dr Peter Allmark, and it's about a study that is called the MAG study. And I'll just give you a bit of background about the MAG study. So many of you will know that Mesothelioma UK has a team of 25 nurses now working in the NHS up and down the country, and those nurses come together often. We communicate every single day without doubt, even over the weekends. And you know, we talk about our experiences and we share our knowledge and talk about things that worry and concern us. And it was really through that network of nurses that we all recognised that we were a bit concerned about the number of healthcare workers we were looking after with mesothelioma. We just saw a bit of a pattern, and I've worked with mesothelioma for many years, and you know, I'd lost count of the number of doctors and nurses and people who worked in healthcare settings that I'd looked after who'd gone on to develop mesothelioma. So it was building on that hunch a little bit and linking with our academic colleagues at the University of Sheffield, who we've done an awful lot of work with, that actually made us think that we really ought to do something about this. And I suppose that the actual the final catalyst was meeting Dr Mags Portman. So Mags Portman was a doctor, an award-winning doctor who worked in sexual health, who was respected worldwide for her work in sexual health. And sadly, Mags contracted mesothelioma. She'd been exposed to asbestos working in the NHS as a junior doctor. And I guess it was meeting Mags, you know, seeing a really, you know, amazing doctor and a young woman with a young family affected by this disease, that really was the thing that made us think we really have got to look at this in more detail. And so it was then that we with support from Mags's family, who helped to fund some of this work, and her family and friends, we reached out to our colleagues, our academic colleagues, who are you know, real experts in their own right now in many aspects of mesothelioma, and looked at designing a study to explore this whole issue in more detail. So enter Dr Peter Allmark, who is a researcher, and he has worked with the team at the University of Sheffield on this study. So welcome, Peter.
Oh, thank you.
Thank you for agreeing to give us this interview. We've been doing so many interviews through the COVID pandemic, as I said, and it just struck me that why not do, you know, we're going to be launching the whole MAGS report soon, and it'd be great to just for people to see the researcher behind the study, and for you to just share with us some of your what you've learned and some of the nuggets really from the study. So I guess with that, I'd just like to say, do you want to just explain to us a little bit about what your role was with the MAG study and how you approached the investigation? You know, what methods did you use?
Yeah, I mean, the acronym that MAGS came obviously from Mags Portman, as you said, but it also stood for or stands for Mesothelioma Asbestos Guidance Study. So it's sort of has a longer term idea of being able to offer guidelines for, or to help develop guidance for healthcare staff regarding asbestos in the future. It was set up, or it was run from the University of Sheffield by Professor Angela Todd, and I was the sort of main research assistant on the project. and it's run from the Division of Nursing and Midwifery at the University of Sheffield. And the starting point for the study was, as you say, really the hunch that you described, that you seem to be seeing quite large numbers of healthcare workers who had developed mesothelioma. And there was also a kind of oddity about it, in that the statistics from the official government statistics, the ONS statistics, suggested that there were very few healthcare workers dying from mesothelioma. This is sort of alongside legal professionals telling you at Meso UK that they were seeing more cases in their individual caseloads than the ONS was recording for the whole of the UK. So it seemed as though there was a much larger extent of this problem than was being acknowledged. And the investigation aimed to do two things, really. One was to get an idea of the scale of the problem, and the second was to hear from healthcare workers who had developed mesothelioma, to get some idea of their kind of experiences, whether those experiences were different from those of other people who developed mesothelioma. The approach to the investigation, we did sort of three main things. The first thing was to look at material that was already out there, material that had already been published. The second was to interview people who had healthcare staff who had developed mesothelioma. And the third was relating to the scale of the problem, was to put in a freedom of information request, and I'll sort of talk about that in a minute. So that was the background, and that's what we did.
And Peter, I know that as part of that review of what was out there, you did look at patient blogs and publications and articles in newspapers and things like that patients had done. And I just wanted to, I'm always saying to patients, please tell your story, because it's so powerful. And I just wanted to capture that it has been really helpful with this study, that you've been able to draw on people's stories through their writing.
Yeah, it's been sort of central to it. We did a kind of normal academic review, a review of the published academic literature, and there is some material, although not an awful lot, about the experiences of healthcare staff with mesothelioma. But we relied quite heavily on what they sometimes call the grey literature, the non-academic sources. So we certainly pulled on newspaper articles and on YouTube broadcasts, and some of them are really powerful.
Yeah.
The YouTube broadcasts, like Dr. Kieran Sweeney's broadcasts are worth seeing from not just from a mesothelioma perspective, but from any healthcare perspective. I think they're very valuable.
Yeah.
So I would definitely agree with that. Yeah.
I mean, I've definitely.
Max's blog was the other thing, wasn't it? Max Paul.
Yes. Yeah.
Blog, and we were able to pull on that quite extensively.
I mean, Professor Sweeney's YouTube video, I've referred to that and used it so many times because it is so powerful, and his words never fail to leave an impression on me all over again every time I hear them. So I agree, they're really useful, very powerful, and I just always say to patients and people affected by this disease, your story is so influential, so please do share it as much as you can. So just building on that, then, we spoke about Professor Kieran Sweeney and Dr. Mags Portman, and I know that we have to observe anonymity, but who else was involved in the study, or what was the background of people that that were involved in the study?
Yeah, well, we wanted to interview healthcare workers, either past or present, who developed mesothelioma, and we managed to find them mainly through Meso UK organisations that it's in touch with. And we interviewed 5 current or former, in fact, I think they were all former healthcare staff, 3 former nurses, 1 former GP, 1 former healthcare assistant. And we interviewed 2 partners of healthcare workers who had died of mesothelioma. And there the healthcare workers have been 1 GP and a healthcare administrator. And that to some extent, that sort of tells you one of the limitations of what we did was that all the people that we saw, really all the literature concerns healthcare workers who work with patients. There's nothing coming from porters or laundry staff, and we know from the legal people who've advised this project or I've spoken to that there are workers in the NHS who, in those fields, who have developed mesothelioma. So it would be nice to get some of their experiences. We didn't do that with this, but we did get, let's say, nurses and a healthcare assistant, which up to now those voices have been fairly silent as well. It's mainly, most of what's out there concerns doctors.
I mean, I certainly can recall somebody worked in a laundry. I can recall a secretary, a maintenance member of staff, and that's just me. So there must be others.
I mean, we had a healthcare administrator, but he was the only one who wasn't a patient facing. But and I guess that's the only bit of data out there at the moment that concerns.
Yeah. So what were the key findings? What were the key themes and findings that you found following the interviews?
Well, from the interviews, in terms of the sort of experience of diagnosis and treatment and symptoms, there's already sort of some literature out there, some of it from Angela Todd in this project, concerning the experiences of mesothelioma project in patients in general, and a lot of those were shared. The shock of the diagnosis, the symptoms, the treatment. There were some indications from the literature that healthcare workers might have sort of different experiences, good and bad, and there was 1 or 2 examples of doctors being able to use the system in their favour to get access to new treatment, or just having knowledge so that they were able to get into trials where other people may not have done. And we had some evidence of that in our interviews. There was also quite a lot of bad experiences reported in the literature, and we found some of those things too. And I think those are quite sort of striking. The feeling of being avoided by other healthcare workers who sort of feel they don't know what to say to you because of the nature of the diagnosis, and there's sort of people not being given the treatment or the reassurance that they wanted, because there's a sense that you should know there's not much we can do, so that kind of thing. So don't come seeking things that we can't give you. So it was sort of treating patients as colleagues rather than as patients first, was a bit of an issue. And I think that's one of the kind of main messages is in terms of communication, as it often is in these cases, that communication was a problem. And I think the other sort of strong message that came from healthcare workers that perhaps doesn't come from other people who develop mesothelioma is that this sort of a sense of disappointment or even anger that they'd been exposed to asbestos at work, sort of unknowingly really, and in an environment that's supposed to be safe. So it's supposed to be safe for them, safe for patients. And there's a sort of, it's quite a shock, really, that isn't necessarily the case. So I think those were two sort of differences. You know, there are differences certainly for healthcare professionals, whether, and I imagine that second thing, the discipline and anger, would be felt just as much by ancillary staff working in the NHS, but no, I don't know that for sure because we didn't do those interviews. But certainly you can see why people might feel that way, why they would expect the health service to be doing more to protect.
Yeah, it's not as if they've worked in occupations that are traditionally linked with exposure to asbestos, you know, in power stations or as laggers or construction workers. And I think, you know, it just goes to highlight how widespread the presence of asbestos is in the UK, and how, you know, possibly no one's spared the risk of exposure. You know, that it's going to be a problem that stays, and unless we make some radical changes, it's going to be a problem that stays with us. And as sad as it is, that was one thing that we really wanted the study to expose, and to put some substance to, some evidence to, because, you know, as you said, the ONS data does not reflect what we feel and what we seem to be seeing. So, you know,
on the sort of scale of side, rather than where the ONS currently looks at recorded deaths of NHS staff due to mesothelioma, there are lots of reasons to think that might be an underestimate. Some of those are kind of set out in the report. But what we did between 2002 and 2015, the ONS had recorded 177 deaths of NHS staff due to mesothelioma, which, you know, everyone was saying that can't be right. What we did was approach the NHS Resolution, which is the organisation that deals with legal cases with people suing the NHS for negligence, and we asked for figures on staff who had developed mesothelioma and had taken cases of negligence against the NHS. And in a sort of a parallel period, it was 2004 to 17 rather than 2002 to 15. We found that there were 961 claims that had been made. Now, not all of those claims won, over half of them won, not all of them won, but all of those people will be people who worked in the NHS who developed mesothelioma. So that's, you know, way more than the 177.
Yes. Yeah.
And we know that figure in itself is going to be underestimated. Amongst the people I interviewed were at least two who didn't take a legal case, either because they just didn't get around to it, didn't want to do it, or because they took it to a lawyer who said it's not a strong enough case to win a case of negligence. It's no good just showing that there was asbestos in the hospital. You've got to show it was badly managed. And that's quite a difficult thing to do. So there's clearly more than 961 in there. Yeah. We know that. What we don't know then is we don't know what the scale of that is. Is it twice that? We have no idea. And so that's something for sort of future work, is to try and wheedle out some idea of what the true extent is. But it's clearly a lot more than the ONS. That's the hunch, and at least we found some evidence to back up that hunch.
I guess that leads us quite nicely into some of the recommendations, because I know looking at the data going forward is one of the recommendations. But do you want to just talk us through what some of the recommendations you've made from the study?
I mean, on the scale, there is that. repeating these freedom of information requests to the NHS resolution seems one indirect way of finding out what the extent is. There may be other ways of doing it, but we need to, for example, through lawyers' cases, but they're quite difficult to do, and we need to discuss that further. In terms of people's experience as healthcare workers, I guess that we've made various recommendations. One of them is really regarding communication in this thing that the person must be seen as a patient first and a professional second. And I suppose that a diagnosis of mesothelioma isn't a sort of reason to back away from someone. It's actually really the opposite. This is a patient first who needs all the reassurance and care that anyone else with mesothelioma would need. We also offer some advice on the education side. There's clearly at the moment the NHS staff are told that it's a low risk environment, and that not many, the INS data is saying not many people develop mesothelioma from healthcare work. That's clearly wrong, and it would seem reasonable to in the induction of new NHS staff, given that the vast majority of hospitals have got asbestos in them, that they are aware of how asbestos is managed, where it is in their buildings, and where they can go to get information about it. It shouldn't be just down to NHS staff, though, to people, workers in those areas. So management probably has the biggest responsibility with regard to dealing with asbestos in hospitals, and then the government at a higher level. And we sort of offer some tentative guidelines, partly based on other people's ideas about monitoring levels of asbestos, which at the moment the level, you have to have very high levels of asbestos to trigger it as a problem. And the other countries in Europe have much better monitoring systems that we should really be looking at and taking on. So we've got recommendations in those three areas of education, patient experience, and also just monitoring the scale.
Yeah, and I think they are really useful recommendations, and I know that once the report has been made available, that we're looking at a publication, and at least one publication, and then the charity going forward. Obviously, our team of nurses, our professional nurse forum, are going to be have some insight into these findings, and actually we're going to be doing some training with those nurses and some workshops looking at how best to care for healthcare workers, and maybe reviewing some of the things that Mag said, and Kieran Sweeney looking at that YouTube footage again, and just reminding us that these people affected in the healthcare service are, yes, they're our colleagues, but they're patients, and that we need to remind ourselves that. And so just, we're going to embrace that. And then we're also going to be looking at how we can engage with people in influential positions within the NHS to get some training, to mandate training. We have an enormous amount of mandatory training in the NHS. It's one of the biggest employers, if not the biggest employer in the country. And obviously maintaining a health and safety, across that big organisation is a huge task. And we want to just chip into that a little bit, if we can. I suppose before we finish, I want to say a huge thank you to you, Peter, because you've been a delight to work with, an extremely thorough. You've immersed yourself completely in this subject area. And I just, on that note, I guess before this, you didn't know much about meso, perhaps. You didn't know much about asbestos in hospitals. And I just wonder what, for you personally, has been the biggest kind of surprise from completing this study?
Well, firstly, I've really enjoyed it, and the interview. I love the interviews. I've had some really nice people for me to interview. I think that in terms of the surprise, I'm surprised by the scale, and the information is being put out to say that these are low-risk environments when it's almost as though they've not looked at it properly, thought about it properly. And I was surprised by some of the bad experience, either that I read about, like Kieran Sweeney stuff, or that I heard about in the interviews. It's always a bit of a shock.
Yeah.
Communication going wrong, or care going wrong. As I say, my background is nursing, so I think most nurses don't like to see that sort of thing happening, even though they know the pressure that people are. And I think these were necessarily because of pressure. I think some of these were to do with attitudes, really. So I think there is scope for improvement.
Yeah, definitely. Well, the charity are looking at how we can take forward these findings and how we can build on them. We're really grateful to you, like I've said, and we really want to thank the participants in the MAG study, and also Mags's family, husband and family and friends who have been supportive of this whole idea. And Mags was herself. I spoke to her on quite a few occasions about our aspirations for shining a light on the situation of mesothelioma in healthcare workers. So thank you, Peter. Thank you for agreeing to the interview, and I hope we get to work with you again on some future studies, because I'm sure there's more we can do with this, and there are other areas of or other careers and other professions and other work environments that I think we need to shine a bit of light on too. So thank you very, very much.
Thank you.